But I don't understand why the regular doctors, the traditional doctor, wouldn't come around to this. I'll bet some of them are. Don't you
Oh,
think?
they
I
are.
think some of them are.
They are,
Yeah.
yeah.
Right. And again, it goes back to our training.
Yeah.
You know, in medical school, this is going to sound really funny, but we probably had, nutrition class for about 4 to 5 hours, and that was it. I mean, that's literally the nutrition training that doctors receive, 4 to 5 hours total in medical school. Mm-hmm. So then, when you start your practice, what are you trained to do? You're trained to give pills for absolutely everything. So it's the doctors that are kind of coming around now, and they're realizing, oh, you know what? There's other things that we can do to make our patients better. Very simple, cost-effective, no side effects, nutrition. So start there, because that will help every chronic illness that we're dealing with, whether it's cancer, diabetes, hypertension, autoimmune disorders. It can help everything.
But there are people that follow this line of thinking and say they have cancer, for example.
Right.
Then they think, well, chemo is going to make me sick and radiation is going to destroy me. So I'll just eat tree bark and nuts and seeds and everything. And that's not good either. So,
Right. Yeah, I mean,
Yeah.
we encourage all our patients to be their own health advocate.
Yeah.
Whatever illness you're dealing with,
Right.
you have to research on your own. As a doctor, we're supposed, the word doctor actually means to teach. We're supposed to teach our patients. So when our patients come in, I don't say, well, you have to do this and you have to do that. No, we're going to discuss what's right for that individual. Every patient's an individual. So what works for patient A is not going to necessarily work for patient B. So we look at everything, we look at the mental aspects of their illness, their physical aspects, and we take everything into account, treat them as an individual, and come up with a plan. Right.
So all of your treatments are pretty much based on dietary recommendations.
That's where
They
we try to start.
incorporate,
We
yes,
try
we
to
always
start
start
there.
with diet,
Because
always.
diet is usually the cause.
And diet doesn't
most of
mean the Atkins diet, so let me just kind of...
Oh, yeah, I know
Yeah,
what you
it
mean,
means
yeah.
basically eating healthy, like...
That's not normal, really, the
No,
Atkins
it's-
diet. No, you can't live
Yeah.
on that.
Yeah.
Right, I mean,
Yeah.
that's not a diet
not
that's sustainable, right?
Yeah.
So I don't like the diets that, you do for 6 months and then you lose the weight and then you gain the weight back.
You
I
do
mean, what's the
immediately.
point?
You gain more.
And, right, because it has effects. Someone, who tells
I
you to
know
eat,
that.
to eat bacon, a pound of it every day, I mean, you're going to have effects from that.